FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.
Welcome. You are listening to the Financial Survival Network. I'm Kerry Lutz. Today is 9/23/20. Well, you know, there's an old saying that statistics lie and liars use statistics. And if you look around at the current COVID situation, you realize that that is true now more than ever. And there's a certain condition, especially among so-called experts, called overcertainty. And overcertainty, self-explanatory, where people think they know something and they really don't, or they don't really understand what they know. I think it was Mark Twain who said, it's not the things you don't know that get you into trouble. It's the things you think you know but are wrong about that do. And I think that's what we're seeing in the COVID fear pandemic, but you be the judge of that. I'd like to know your opinion. Please email me, kl@kerrylutz.com. And as always, we answer all. Right now, I've got William M. Briggs on the phone with us, statistician to the stars, a one-time professor at Cornell Department of Medicine, a PhD in statistics, and his specialty is overcertainty in scientific situations. And I've been reading your work, William, for quite a while now. You've got a great website, WM Briggs. That's BRIGGS.com. And hey, so let's take a statistical view, divorced from emotion and fanaticism, of what's really going on here with COVID-19.
Sure. What we're experiencing here is a very typical, not at all unexpected pandemic, of which we see every 10 to 20 years. The last one was in 2008, swine flu. That killed, the upper estimates are around 600,000 people. The one before that, the big one before that was the 67 Hong Kong flu. That killed about the same number of people that are said to being killed by the Corona doom, the current one. And the one before that was 10 years before that, in 57. That was the Asian flu, and that killed about 2 million people, twice as many, or at least twice as many, and so on, back through history. These things are a completely regular occurrence. But this is the first one. This one is unusual in that this one caused the very first ever global panic. This one, for some reason or another, for lots of reasons, it was fixed everybody's attention. Everybody started tracking this disease, not only week by week, but day by day, even hour by hour. You couldn't go anywhere without seeing every news report, every news station, every media station updating you on the latest number of people who might have caught this, might have caught the bug, or might have died from it, over and over and over. And naturally, that panicked everybody, not just in the States, but all over the world, with some bright exceptions. And this caused the governments to react and to overreact and to hyperreact and to begin locking the healthy down. The healthy were quarantined, which is the first time in history that we've done something like this. And suddenly the healthy people were starting to become sick. Because let me ask I'll ask you and ask your listeners, why is it that the cold and flu season is in the States anyway in the wintertime?
It's because everyone is indoor, and transmission through modern HVAC systems, and in cities with older housing stock where there's dense population, it gets transmitted through the air, and we all breathe the air.
So the solution the government came up with was to lock people into these structures, don't let them go out. It's absurd. 2020 is the year every expert pretended to forget everything they knew about viruses. There's been no, except like I say, with some exceptions, there's been no sane or logical response to this crisis, which is largely man-made. since the beginning, since the first news leaked out of China about this, probably intentionally leaked out and exaggerated by Chinese media sources. But there's no other explanation for this. And governments have loved it. Governments have absolutely latched onto this. They're enjoying their newfound powers. All they had to do, Governor Whitmer of Michigan is an excellent example. She just says, you know what, there's a state of emergency. How is there a state of emergency? Nobody knows. She just says there is, and so there is. And now all of a sudden she has near dictatorial powers that she can do anything she wants to combat this state of emergency. And she can extend the state of emergency over and over again, as she has. The legislature, which is somewhat against her, tries in an anemic way to fight it. But they're also dealing with the citizens of their state, for instance, who are largely panicked. They're believing all of this stuff. People, it's not just the governments. I don't want to put the whole blame on governments. People, to a large extent, most people are panicked still, even at this date. For instance, in New York City, back during the beginning of the news cycle, if you like, back in March and April, when the deaths were being recorded were at their peak. On the streets of New York City, maybe a quarter to a third, at first only Asians, were wearing masks. Now, since around June 1st, there's been almost no deaths. And that's been, 3 months now or more, 3.5 months. There's been a few trickle of deaths that they're attributing to the corona doom every day. But now, at this point now, even after 3.5 months of nothing happening, the people are more terrified now than ever. About 95% of the people are wearing masks. If you go out without a mask, people will avoid you, will shun you, will actively walk away from you like you're some kind of leper. It's a really astonishing thing to see that the people can keep up this level of fear for this long, even in the absence of evidence. That's the thing that you have to ask why.
Yeah, it's remarkable to me. And I'll go in. I found the best way around it. You just need a face covering. So if I'm going to be in a store for 2 seconds, I don't even put the thing around my face. I have these neck gaiters. I just cover my mouth and nose while I'm there. And then when I turn around, I'm leaving the store and there's no one around. I just pull it off and walk out. And they try to tell you, go in this door and exit this door. At the Starbucks. And
well, that's exactly right. The coronavirus can tell which direction is in and which direction is out. There's so many absurdities like that, one after the other. So, for instance, at church, they allowed you to sit in every other pew at many of the churches I have been to when they finally opened up, when they finally had the guts to open up. Now, you could sit as many people as you like side by side in the pew, but you could only use that because, of course, the coronavirus can only travel front to back, not sideways.
And it can only go in a straight line.
No sense to this.
Right?
Exactly.
It can only go in a straight line. It can't zigzag because it's like an alligator. When you're being chased by an alligator, you're supposed to zigzag because the alligator can only go in a straight line and it'll confuse them. And I guess it's exactly the same thing with COVID. It can only go in straight lines. It doesn't know how to go three-dimensionally. And we've seen the research on masks. Masks have just shown to be pointless unless you're wearing an N95 mask that has been perfectly fitted to you and that you sterilize every 4 hours, because after 4 hours, probably be putting out more viruses than you're taking in.
That's exactly right. This is what people don't understand. It's not like the medical researchers haven't looked at this question before. It's, when should you wear a mask? I don't want to sound like you should never wear it. If you're actively sick,
right?
If you have an active infection, if you have the flu, even if you suspected to have the corona doom, well, of course, wear a mask or try to avoid people who you're likely to pass it to. That's just common sense. But if you're a healthy person, especially a young, healthy person, wearing a mask has no use. And You could prove it. Then they've studied it time and time again. I have a collection of these papers I just put up. Not my papers, just papers from the medical literature looking at this question. And, if they try to find something in using the methods, the statistics that they use, they can find it. And I'll put find in air quotes. They look hard for trying to find whether these masks are efficacious, and they can't find it. There was a recent paper that just came out looking at called a meta-analysis. And what they do is they gather all sorts of papers on the same thing, look at them together. They found absolutely no effect of masks in the healthy in preventing transmission of flu. It wasn't coronavirus, flu or cold, but the coronavirus is just another cause of the common cold. There are many coronaviruses. We've had it with us forever, and we will have this bug with us forever. Like we still have the Spanish flu bug with us forever. But in any case, masks just don't work. Yep. And if you think masks do, if you're just convinced they are, and you can't get this out of your head because you believe a mask is going to protect you, well, then by all means, wear a mask. But why do you have to legislate it so that it becomes a crime? A crime, like stealing, to not wear a mask. And not only that, if you think masks work, well, then the masks work for you. Why should I wear one? Yeah. Doesn't your mask work? Or no? Yeah. So the whole thing is absolutely unreasonable, but it becomes obviously a very visible way to show that you've done something, not only as a terrified person, but as a politician who could mandate these things or criminalize their non-use. So it's a very easy thing to do for politicians and for people, and that probably is why we're doing it, for that reason alone, just because of its ease.
Yeah, and they have to appear to be doing something, because originally in Florida here, Governor DeSantis was resisting the calls to shut down the state, resisting the calls for all these draconian measures, and finally they overwhelmed them, and he just couldn't say no. But he did them as least intrusively as possible. We were shut down here for a month, basically the month of April, and now we're reduced to wearing masks and only eating dinner outside, which is another thing. How many people wear masks, William, when they're outside? And read the same studies as I have, that there's virtually no risk of outdoor transmission.
FSN Radio. It's all about what's next.
Today's show is brought to you by GR Silver Mining, ticker symbol TSX, GRSL, OTC, GRSLF, and their website at grsilvermining.com. The company is extremely well capitalized, currently has a resource of 40 million ounces of silver, and is looking to triple that number in just the next year alone. Its management team is first rate, headed up by Marcio Fonseca, a geologist with vast experience in mining operations and the financial sector as well. With all this going for it, and with silver trading over $25 the ounce, there's no telling how high GR Silver Mining will go. So go to grsilvermining.com to stay up to date on the latest developments and get on their notification list today.
The Financial Survival Network. It's all about what's next.
It's absurd. The sun alone, especially in Florida, hot, humid areas, kills any kind of virus almost immediately, and it's absurd. You have to, in these restaurants, most of the places they have this, you have to wear a mask when you're walking around, but when you're sitting down, smacking your lips, eating, talking, carrying on, drinking, well, then the virus doesn't know. The virus can't transmit, so it's okay. It's absurd. There's no logic to any of this. It's just to be seen to be doing something. And like you say, DeSantis tried and then caved, but he didn't have to. We have plenty of examples of other countries in which they did nothing. Nothing except for the most minimal things. People and they did fine. In fact, the shape of the curve looks like a standard curve we see in every single outbreak of any kind of these transmissible viruses. For instance, Sweden. Everybody points to Sweden. Sweden they have very mild restrictions, like no gatherings of people larger than 50. Okay, fine. And I'm sure that wasn't even very well policed. But that's it. But the shape of they probably reached herd immunity, which everybody's probably heard of, like we have to all these other viruses that are still with us. And they did better than England, which is now swearing they're going to go into a second lockdown, another terrified response. They did better than Belgium. They did better than France. They did better than Spain. They did better than all these places because they didn't panic. But what everybody forgets to mention is Japan.
Yeah.
But why? Because maybe it's too far away for people to think of. They didn't have a lockdown. They have a lot more people. They have 160-some million people. They have only a fraction of the number of deaths. No lockdowns.
Correct.
So they have. What about Taiwan? Taiwan has had like 7 or 8 deaths. They have like 30 million people on Taiwan. They didn't have any lockdowns. What about all? It seems in Africa it hasn't spread very much in Africa. A lot of places have not had lockdowns, but some have. It just all of
Georgia?
These measures that people have taken. Georgia, the country or the state?
The state of Georgia. You know, he was the first one. He was reckless. Even Trump told him that he was being a horrible person, and yet he still did it.
Yeah, exactly. And they're fine. A lot of places have. You got to understand that you can't, when you're comparing countries, you have to be difficult. You have to be careful because Sweden is, got the population size of like New York City or something. So you have to compare like similarly sized regions and populations and so forth. And America is a huge country. And so we have obviously a north and a south part of America. The north part of America gets its cold and flu season before the south part of America.
Correct.
And so the southern states got their wave of the transmission as they got the wave of transmission of every other virus a little later. So, but the way the news media reports is as if it's a second wave. No, it's not. It's the first wave of the very expected outbreak that we have in the South. And so Georgia did fine. There were 8 states in the country that did not lock down and had no measures, although South Dakota up until recently had no measures except for local cities. Now some of them require masks, but they did the best in the death count. South Dakota, North Dakota, Montana, I think Arkansas, but Arkansas eventually caved on the masks and made it a crime not to wear them, and so on. There were 8 states, and they did fine.
Yes.
So why couldn't we have done this everywhere? That's the real question is why the lockdowns when they were proven not necessary. And I'll tell you who said. We could make an Abbott and Costello routine out of this, but I'll tell you who said that lockdowns were not efficient, should not be used. And that was the WHO itself, the World Health Organization.
Yeah, who's on first?
They had a paper that came out in 2019 that said, here are a range of measures, just coincidentally. There's a lot of coincidences in this coronavirus. Yeah. But they said, don't use lockdowns. Don't quarantine the healthy. It's not going to do any good. And then they immediately forgot they said that after Chinese money got involved in early 2020. And then all of a sudden lockdowns are fine. They went against their own studies. And we have this whole situation detailed. We have a book coming up. I hope you don't mind if I plug it.
Please.
It's called The Price of Panic. It's with me, Jay Richards and Doug Axe. Jay Richards is kind of doing the economy side of things. Doug Axe is our biologist, so he's doing all the virology and so on, and I do the numbers. But we look at this thing from start to we had to stop writing at the end of May to get the book out. It's going to come out in October. So we don't have all the latest numbers in it, but we have a lot of stuff that we're doing, like I have on my blog and so on. But it's really a political story more than a medical story.
Yeah, it really is.
As far as medicine goes, like I say, it's not in the least bit unusual. It's not strange. It's not weird or anything. It's not anything that was unexpected. So what we really have to worry about is once they finally, maybe after the election, people forget about this and they move on to the next terror, and this goes away. But they're already starting to. We have to worry about precedent. because the people welcomed this and their terror. They welcomed this. For instance, in Michigan, I concentrate on Michigan. I don't know why. There seems to be a lot of stories coming out of Michigan. The other day, their internal health organization, whatever it's called, they had found this encephalitis mosquito spread thing in horses, another disease that spread in horses. And they said there was one suspected case in a human, but only a suspect case at that time. And they advise, what did they advise? Everybody in the center of the state to stay in their homes, lock them down again. So, why not? If that's going to be the solution, that's what they can do. How do we know they're not going to do this for every flu year now? Because the flu is a very real thing. The flu kills up to 650,000 people every single year, not in the States, worldwide. Just like the swine flu outbreak killed about as many. Every year the flu kills as many. Are we going to lock people inside indefinitely now?
Yeah, this is just madness. Hey, and what about those statistics that we're getting? In Florida, there were 146 reported deaths yesterday, but of people who actually died yesterday, there were 2, which means the thing is over, but nobody has bothered to tell us about it.
Yeah, I warned people from the very beginning of this. Medical data is a mess, and that's the problem with this hyper concentration on these statistics. Everything looks like it's new and happening now. No. These reports come in, the CDC compiles, at least there's some groups still inside the CDC that are trying to be, I don't want to use the word honest, but they're still trying to do their job. They collect these all-cause death statistics, and they always have. And it takes up to 8 weeks for the counts to become complete. So you can't look at the counts that come in now as if they all happened now. It's just not the case. A lot of these things, they finally compile. They come from some county, and they've been holding them for months. They've been collecting for months. Now they report them, and all of a sudden it looks like a spike. And the media is not smart enough to go in there and look and see that, no, this is just the way the reporting has always worked, but nobody's cared up until now how this reporting has worked because it was not that consequential. It's still not consequential medically. We can wait 8 weeks to find out the total death count in the old days. Now everybody has to know instantly, and it's that desire for the instant knowledge, and in part, these new methods of spreading this instant knowledge through social media, which was just beginning in 2009. It wasn't nearly the same global reach that it has now, but now, of course, anything that happens is instantly available to everybody, everywhere. And I think that accounts for part of the reason this disinformation has spread so rapidly.
Yeah, disinformation. And we see it all over the place where at least I used to think a death certificate is pretty straightforward to fill out. But evidently, when people don't die in hospitals and they don't have their records there, it becomes a discretionary matter of the physician to just fill in the blanks. And therefore, the hospital getting paid extra money for treating COVID-infected patients, all of a sudden, everything's coming up COVID. That could be a song, everything's coming up roses, everything's coming up COVID.
You're exactly right, though. New York State did that famously, or infamously, I should say. They were looking back in the death records early on in this thing, back in March or April. I think it was April. And they looked at some of these people, and you say, you know what? We didn't measure whether or not these people had the corona doom. But, they might have. So we're going to count all these 2,000 deaths, a big spike on one day, as corona doom deaths. And they're not the only ones. Many people now, in parts of England, they come out and say it. Any death within 28 days of a positive test on the corona doom is labeled a coronavirus death. They're doing everything they can to possibly label any kind of death whatsoever as caused by corona doom. Now, we were chatting before the show, but the CDC did come out with a number. They come out with this number looking at the number of people who died, possibly just of the coronavirus and nothing else. This was the leading cause of death. And that was only about 6% of the reported numbers. So about 6%, the CDC has 185,000 right now. The media is trumpeting over 200,000, but I don't know where they get their numbers. The media always exaggerates, but the CDC officially has, as of at least yesterday, 185,000, a little less, people who died in one way or another with coronavirus, but only about 6% of those died just of coronavirus. The rest died of multiple causes. And they found that it was between 2 and 3 other causes that most people have. So the 94% who are being called a coronavirus death actually had 2 or 3 other illnesses or more. These are old, fat, unfortunately, unhealthy people who are dying, and they're being called, and the deaths are being labeled coronavirus deaths. This is a problem, like you say, with the death certificate. It's a well-known problem in medicine. If you have COPD, chronic obstruction pulmonary disease, and you're wheezing away, and you're obese and perhaps pre-diabetic, which is a very common suite of symptoms, and you're 80 years old, which maybe is not an untypical Florida resident, and you get the coronavirus, and you develop pneumonia. It's the pneumonia that kills you. Now, what did you die from? Did you die from COPD? Did you die from the obesity? Did you die from the pneumonia? Did you die from the coronavirus? What do you put on the death certificate? You got to put one. Yeah. And as you say, because of the financial incentives and the political incentives, a lot of people are just moving to put coronavirus.
Isn't it amazing? And I think we'll leave it at that. That going back to it again, I think it was Churchill who said there are lies, damn lies. And then there's statistics, right? But statistics, the only math course in college that I ever actually got an A in, can actually help explain things rather than obfuscate them. But I think what we've seen here is that they've been used to do the exact opposite of what they're intended to do, and that's to cause fear, panic among the public. The numbers themselves mean nothing. I mean, just to sum up, 200,000 deaths in the United States out of 350 million people, give or take, and that they came from one particular cause like that isn't statistically significant. But if you say that to somebody, they assume that you're saying, well, those people's lives weren't significant and that you're insulting them and you're a COVID denier and all this. But the reality is 200,000 deaths in almost 10 months, 9 months, it's not significant. 100 deaths in one day in a state of 22 million people, it's not statistically significant. And the other thing, just before we conclude, there was some baseline level to be considered a pandemic, and I think it was 5.5% of all deaths happening for a week. And we almost got to that in July, and then all of a sudden, the deaths picked up, and it was all talk of declassifying it as a pandemic or gone. So
that's correct.
Yeah,
that's correct. There is no more pandemic. That's gone. There's local outbreaks of which is now a minor one disease among many. It's reached a level that car crashes are now maybe 2 or 3 times as high number of deaths in the United States than coronavirus deaths right now.
Exactly. But
we're not banning driving.
Yeah, it seems like we have a driving death pandemic here, and maybe we got to stop people from getting in their cars to go driving because they might die, and who knows what'll happen then, right? So, in any event, just tell us your website again, will you?
WMBriggs.com.
All right, and there's a link to it in the show notes. Really appreciate you coming on. Any questions or comments, please write us, KL@KerryLutz.com. If we're on YouTube, they'll probably take this down at some point, or I don't monetize YouTube, so I don't really care about that. Maybe they won't take it down. Who knows? They'll sandbox it. That's what they do. In any event, just send us an email, KL@KerryLutz.com, with your thoughts. Check out our website, financialsurvivalnetwork.com. Now more than ever, you need us. Professor Briggs, we will talk to you again real soon. Thank you so much.
Thanks for having me.
FSN Radio. It's all about what's next. Go to financialsurvivalnetwork.com and sign up for your free weekly newsletter. You'll also get 3 free reports. The Financial Survival Network. It's all about what's next.